So this is the first video of several I'll be doing with regard to osteoarthritis and in particular hip and knee OA. And in this video I'll be talking about what osteoarthritis is and some of the symptoms you might be experiencing. And in the next couple I'll be talking about why it happens and some of the treatment options available. So what is OA? Well, over time the structure of the cartilage at the end of your bones changes and it becomes thinner. And it affects the whole joint, so you'll experience some of these structures around that joint, so the joint capsule, the ligaments, the muscles and the underlying bone, they're all sort of pain sensitive structures and can contribute to pain and disability. It affects the whole joint, as I've said, and often it's described as wear and tear. And I think this is sort of falling out of favour a little bit because it's quite an unhelpful label that we put on clients or patients, in that people assume then because it's wear and tear that they should move less. And actually the opposite is true. And we know that to maintain healthy cartilage it needs a certain amount of load through it, so exercise is particularly beneficial. So it's important to kind of get that sort of message across really. I think it's also important to understand that it's unhelpful to solely focus on the cartilage as the problem, as we know from a lot of the research that pain and disability with regard to OA is really complex, as we'll discover in the next couple of videos. So what are the symptoms of osteoarthritis? Well, often weight bearing is painful, but also you can be in a lot of pain at rest as well, so it varies quite a lot and often the pain can be quite random. There's often a lot of stiffness in the morning. Usually it lasts for sort of less than half an hour, but you'll find the hip or the knee is a bit stiff and you'll notice that the range of motion isn't quite as good as it used to be. And you'll find that some activities of your sort of everyday life might be harder. So for instance, like putting on socks or shoes, gardening, or going from say sit to stand might be a bit more tricky. And other things you would have previously found quite easy, just a bit more challenging in terms of pain and discomfort and reduced range of motion. I think it's very much down to the individual as to what they're experiencing, and often pain can be quite random as well, and it's often very difficult for the person to know how much or how little to do. So I'll be running through some sort of solutions to that later on in the next couple of videos. And as I say, the next video I'll be talking about why osteoarthritis happens and some of the treatment options available.